Welcome to the Motivational Midwife. I'm Lynn Jones, and I thought it might be nice to put a short video together really as a bit of a motivational pickup for those of you that are struggling. And I know during COVID there'll be a lot of you struggling with your studies at the moment. People make the assumption that because I do the job I do and have done the job I've done in university, that I must somehow be really, really clever. But actually, it's been a long struggle for me to get where I've got. In the days when I trained, it wasn't a degree course, either for nursing or for midwifery, but it was still a difficult course. And I think you need to remember when you're having your difficult days, why you came into the profession, why you wanted to be a nurse, why you wanted to be a midwife. Somewhere when you went for your interview, someone saw something in you that they thought you would make an excellent midwife. And you need to remember that, out of hundreds and hundreds of applicants, you were picked to do this training. So someone somewhere saw a spark in you that they felt would make a great midwife. It is a difficult course. It isn't easy. There's a lot of academic work, and we're not all natural gifted academics. I certainly am not a naturally gifted academic, and I have had difficulties when I was doing my master's. I really found it tough, having never done a degree before and then doing a master's. And there were days where I really struggled with assignments, and I just thought, gosh, what am I doing? I must be mad. But then I went back and remembered, why was it that I wanted to be a midwife? Why did I want to do the masters? Why did I want to better myself and make a difference to the profession? And I know that I have made a difference over the 40 years plus that I have worked as a nurse and a midwife, from the feedback that I get from the women and their families, and when I was a nurse, from the feedback I got from my patients. So, we are very, very privileged as midwives to be part of families' birth journey. And we must never forget that. We must never take it for granted. So you are very lucky to be on this course, and I'm sure you're aware you're very lucky to be on your midwifery training. That said, though, it is a tough old road. It's not easy, and COVID-19 has made it extraordinarily difficult for you. If you're finding that you're struggling with your academics side of things, then there is a wealth of support out there, but you need to access it. Firstly, find someone that you can go to, that you find that knows you, that understands you, that sees where you're coming from, that you can have a meltdown in front of and they're not going to judge you for it. And that can help pick you back up again and get you back on the straight and narrow. And that might be a family member, it might be a friend, it might be someone in your cohort, it might be a midwife you work with, it might be your personal tutor or one of the other tutors at your university. But have that person that you can go to, that you can rely on. Many of the services also, the universities also have mental health services that you can access now as well. So do access those. There's no shame in accessing mental health support, particularly at this time. With your academic writing, and believe me, I do know that can be a real struggle. I work with people who can knock out an A-star essay in an afternoon, which would take me months to write, and probably still not get an A-star. So I know that these things can be really, really challenging. But you'll probably find those of you that are weaker academically, you shine in the clinical area, because we all have the areas that we are good at. And I'm much more of a practical see one, do one person than a write about it person. Other people I work with write the most amazing pieces of work. They're still good in the clinical area as well. But, their forte is that sort of academic side of things. So we all have the areas that we shine in, and don't forget that. You don't need to have 100% essay to be a good midwife. You do need to pass your essays. You do need to pass your academic work in order to qualify. But whether you get 50%, 70%, 100%, it's not going to make you a better midwife specifically. The more knowledge you have and the more understanding you have, that will make you a better midwife, but not necessarily the essay that you've written. So it is important that you try and link the theory that you learn in university to what you're seeing and doing in the clinical workplace. And this is where my channel, I hope, will help you. So if you haven't subscribed to Motivational Midwife, please do. And we, over the next few months, will hopefully be releasing lots of videos that will help you link theory to practice, both in complex and normal midwifery areas. Within your universities, you've got a lot of support. Okay, you've got your tutors, you've got your personal tutors, you've got the library staff, and the library staff are amazing, particularly to help you with academic work. All universities will have resources in place, even during COVID, that you can access. So you may be able to book a one-to-one with a librarian that can discuss with you about how to format an essay better, or how to make your essay more critical in its approach. Because as midwives, many years ago when I trained, you did consider research, but not to the same level that we consider research now. We really look at research now as midwives, and we really pick it apart and think, how robust is this evidence that we're being asked to change our practice for? Whereas many, many years ago, we would have probably just accepted it and gone with it. So it's a good thing that we are really critical of the evidence, but from your writing perspective, that's something you need to develop, is how to actually get that criticality across in your written work. And your librarians and your tutors are fantastic at helping you do this, but you do need to access them. If you have extra support needs, so you maybe have dyslexia or something like that, then make sure that you are accessing all of the support that you are entitled to while you're at university. If they don't know about you, they can't give you that support. So please do flag it up. Use your students' union to help support you in gaining access to those things that you need. But most of all, as I say, when you're having a down day, when you're thinking, oh, I can't do this, it's all too hard, I'm going to throw the towel in, go back to the fact that someone saw something in you to offer you that training place. And why did you want to be a midwife? Why did you want to come into this profession? Why did you want to try and make a difference? And it will get better. You will get through it. Even as a qualified midwife, you will have those days where you just think, what am I doing? I retired and I went back into clinical practice, and I find myself thinking, what am I doing? Why did I do that? But those days are few and far between, because even on the busiest, most stressful days, I try and remember I'm making a difference to one person, or maybe two persons if it's a really busy day, 2 or 3 people, but I'm trying to make a difference to that one person that I'm looking after at any given point in time. So I hope that's been helpful. I hope that's picked you up a little bit and fired you up ready to get back in and get on with things. As I say, if you haven't subscribed to the channel, please do, and I look forward to seeing you on some of our teaching sessions. Take care.